All right, folks, our next guest is Davies of Walsh Urology, and she's here to teach us about a survey that can save your life. Does that sound about right?
Absolutely. It certainly will help decrease some of your symptoms that you may be having.
Well, welcome to the show.
Thank you. Thanks for having me here.
Of course. So we're talking about a survey, the IPPS survey. What is that?
So it's a survey that we use in the office quite frequently with every patient that comes in, and it helps to determine what kind of symptoms are these patients having. It's an international survey, and it studies both storage ability of urine and urinary symptoms that the patient may be having.
Gotcha. And I know we've spoke to doctors about BPH in the past. Can you give us just a quick, give us some insight about BPH?
So BPH is very common with men, and as men age, their prostate continues to grow the tissue. And what happens is it causes some obstruction of urinary flow. And with that comes urinary symptoms for men. And so with the survey that we ask them, it helps categorize what kind of symptoms are they having. Some can be more severe for men, some can be less severe. And it gives us a guideline as to what kind of treatment plan that we can put forward with the patient.
What are some symptoms that somebody should look out for?
Well, as a prostate enlarges and there's obstruction of urinary flow, there's decreased ability to maintain a bladder with urine. So you have the storage difficulties. You have frequency, you have nighttime frequency, daytime frequency, and then some urgency as well. And then as far as urinary symptoms, there can be a decrease in the stream. A man can have a strong stream, and then when BPH starts taking place, it can weaken the stream. And there can also be a sensation you're just not emptying your bladder well enough.
Okay. So can you give us an example of the survey?
Absolutely. Do you have a copy of our survey?
I don't.
Okay, so
Unprepared party of one.
Okay, so an example would be a question: how often are you urinating during the day? How often do you get up at night to urinate?
I feel like I should be answering you. Go ahead.
Do you feel like you're emptying your bladder? Are you urinating and then 5 minutes later you have to urinate again? Has your stream changed? And is there any hesitancy or any straining to urinate that you're experiencing?
There's the example of the survey.
There we go.
We do have it. Okay, gotcha.
So these are the questions, and the patient will mark down score as indicated there, different numbers as to with regards to the severity of the symptom that they're experiencing.
And so once you get the results, I mean, what does that mean?
Well, it gives us an indication of, is this something that you can live with? If you had these symptoms, is this something that you could live with the rest of your life? If the man says, no, I'm tired of getting up 5 times a night, then we look at what options are available to treat the current condition and to decrease these symptoms that he's experiencing.
So when should a man see a doctor about prostate symptoms?
Whenever the symptoms are bothersome for him.
Simple as that. So as soon as you see them, it's important to jump on it.
Absolutely.
All right. And how young? Like what? Like I'm 39, so I feel like I should really start to be aware of these things.
There are men in their late 30s, early 40s that start experiencing symptoms of BPH.
All right. I guess it's my time, everybody, and yours too. Register for upcoming free men's health seminars by calling 855-564-9722. You can find Walsh Urology in Rancho Mirage. Schedule an appointment or consultation by giving them a call or checking out their website at walshurology.com. Big thanks to Davies for being here today. Very insightful. I appreciate having you here.
Thank you.
Yep, and don't move a muscle. We'll see you in just a couple minutes.